All right, let me ask you something. What if I told you that one simple habit you do for just 5 minutes before bed could completely change the way your body responds in the bedroom? I know. It sounds like one of those doctors hate this one weird trick scams. But here's the thing. What I'm about to share with you isn't some magic pill or expensive supplement. It's a natural technique that's been used for centuries, and it's backed by solid biological science. I'm talking about strategic oil application. And no, this isn't snake oil. This is about working with your body, not against it. Now, if you're over 50, you've probably noticed some changes. Maybe mornings aren't what they used to be. Maybe things take a little longer to get going. Maybe you've felt that quiet frustration when your body just doesn't cooperate the way it did 10 or 20 years ago. Here's what nobody tells you. This isn't just about testosterone. Sure, testosterone drops about 1% every year after 30, but that's only part of the story. The real issue? Blood flow. Circulation. The ability of your blood vessels to expand and deliver oxygen-rich blood exactly where it needs to go. Think about it like this. Your blood vessels are like garden hoses. When they're new, they're flexible, smooth on the inside, and water flows easily. But after years of use, especially with stress, sitting, poor diet, inflammation, they get stiff. They develop buildup on the inside. The flow slows down. And when that happens in the vessels that supply blood to your penis, well, you feel it. But here's the good news. Your body wants to work. It's designed to repair itself. It just needs the right support. And that's where this nightly oil routine comes in. Because what you do before bed can literally prime your body to restore circulation, relax tense muscles, and support those natural nighttime erections that signal everything is working properly. This isn't about turning back the clock. This is about giving your body what it needs to function at its best, right now, at the age you are. And the best part? You can start tonight. Let me break down exactly what's happening in your body after 50, because once you understand the science, everything I'm about to tell you will make perfect sense. Erections are fundamentally about hydraulics. Your penis contains 2 chambers called the corpora cavernosa. Think of them like sponges. When blood flows in and fills those sponges, you get an erection. Simple, right? But here's what changes with age. The tiny blood vessels that feed those chambers, called capillaries, they start to narrow. The endothelium, which is the smooth lining inside your blood vessels, it gets damaged over time from inflammation, oxidative stress, high blood sugar, and just general wear and tear. When that lining doesn't work properly, your blood vessels can't relax and expand the way they should. On top of that, you've got something called arterial stiffness. Your arteries lose their elasticity. They become more rigid, like old rubber bands. This means less blood flow to everywhere. Your heart, your brain, your muscles, and yes, your penis. Now here's something most men don't know. Your pelvic floor muscles play a massive role in erections. These are the muscles that run from your pubic bone to your tailbone, supporting everything in your pelvic region, your bladder, your prostate, your rectum, and the base of your penis. When these muscles are tight, weak, or inflamed, they compress blood vessels and nerves. It's like putting a kink in that garden hose. Even if your heart is pumping blood efficiently, if these muscles are tense, the blood can't get where it needs to go. And guess what happens as we age? We sit more. We lose muscle tone. We develop chronic tension in our hips and pelvis. All of this compounds the problem. Here's another piece of the puzzle. Chronic low-grade inflammation. You might not feel it, but as you age, your body accumulates inflammatory compounds. This inflammation damages the delicate tissues in your pelvic area, reduces nerve sensitivity, and impairs the signaling that triggers erections. Think of it like static on a phone line. The signal is there, but it's getting disrupted along the way. Your brain sends the message, but your penis doesn't receive it clearly. So now let's talk about why oil works. And I'm not talking about just any oil. I'm talking about specific oils applied in specific areas that can actually penetrate the skin and influence the tissues underneath. The oil I recommend most is castor oil. Now, I know it sounds old-fashioned, but castor oil has been used medicinally for thousands of years. The active compound in castor oil is called ricinoleic acid, and it makes up about 90% of the oil. This fatty acid has powerful anti-inflammatory properties, and crucially, it penetrates deeply into tissues. When you massage castor oil into your lower abdomen and pelvic area, several things happen. First, improved local circulation. The mechanical action of massage combined with the warming effect of the oil stimulates blood flow. You're literally bringing fresh, oxygen-rich blood to the area. This helps repair damaged blood vessels and keeps them flexible. Second, reduced inflammation. Ricinoleic acid reduces inflammatory markers in the tissues. This means less damage to the endothelium, better nerve signaling, and improved vascular function. Third, lymphatic drainage. Your lymphatic system is like your body's waste removal service. It clears out toxins, dead cells, and excess fluid. Castor oil is one of the few substances that can stimulate lymphatic flow through the skin. When you massage it into your pelvic area, you're helping clear out congestion and swelling that might be compressing blood vessels. Fourth, muscle relaxation. The massage itself helps relax those tight pelvic floor muscles. When you apply firm, gentle pressure to the area between your scrotum and anus, the perineum, you're directly accessing the root of your pelvic floor. This releases tension, improves nerve function, and allows blood to flow more freely. Now, timing is everything. Doing this routine at night takes advantage of your body's natural repair cycle. Between 10 p.m. and 2 a.m., your body produces the most testosterone and growth hormone. Your blood pressure drops during deep sleep, which allows your blood vessels to relax and expand naturally. Plus, this is when you experience REM sleep. That's when your body tests its equipment. You get 3 to 5 erections during the night, even if you don't remember them. These nocturnal erections are actually your body's way of keeping everything functional, bringing fresh blood and oxygen to the penile tissues. By doing this oil massage right before bed, you're priming your body for optimal repair. You're supporting the natural processes that happen while you sleep. You're giving your body the best possible conditions to restore function. Some people ask, does oil really absorb through skin? Yes, absolutely. Your skin isn't a barrier, it's an organ. A living, breathing organ that absorbs substances all the time. That's how nicotine patches work. That's how pain relief creams work. And that's how therapeutic oils work. The skin in your genital and pelvic area is especially thin and permeable. It's rich in blood vessels and nerve endings. When you apply oil here, especially with massage, you increase penetration even further. The warmth from your hands, the friction from the massage, and the natural permeability of the tissue all work together to drive the beneficial compounds into the deeper layers. This isn't magic. This is basic physiology. You're using your body's own absorption mechanisms to deliver anti-inflammatory, circulation-boosting compounds exactly where they're needed most. All right, now that you understand the why, let's talk about the how. I'm going to walk you through exactly what to do, step by step, so you can start tonight. First, the oil. I strongly recommend organic cold-pressed castor oil. You can find this at any health food store, most pharmacies, or online for about $10 to $15. One bottle will last you months. Make sure it's hexane-free and organic if possible. You don't want chemicals in something you're applying to such a sensitive area. If you can't tolerate castor oil, some men find it too thick or sticky, coconut oil is an excellent alternative. It's lighter, has natural antibacterial properties, and is easily absorbed. Almond oil is another good choice because it's packed with vitamin E, which helps repair tissue and improve elasticity. But if you want the strongest anti-inflammatory and circulation-boosting effects, castor oil is king. There are 2 specific areas you need to focus on. These aren't random. They're strategically chosen based on anatomy and blood flow. Zone 1. Lower abdomen. This is the area right above the base of your penis, below your belly button. Place your hand flat on your lower abdomen, and you'll feel it. This region covers the major blood vessels that feed your penis, the pudendal arteries and the dorsal arteries. It also covers the root of your pelvic floor muscles. When you massage oil into this area, you're directly stimulating blood flow to the penile chambers. You're warming the tissues, relaxing the muscles, and bringing fresh circulation exactly where it's needed. Zone 2, the perineum. This is the area most men overlook, and it's absolutely critical. The perineum is that small space between your scrotum and your anus. I know, it sounds awkward, But this zone is directly connected to your prostate, your pelvic floor, and the deep arteries that supply blood to your penis. When you apply gentle pressure here with oil, you're doing several things: reducing prostate congestion, releasing tension in the deep pelvic muscles, improving circulation to the internal structures, stimulating nerve pathways that control erections. This is where the magic happens. Most men have never massaged this area in their life, and they're shocked at how much tension they've been carrying there without even knowing it. Here's the step-by-step process. This should take you about 5 to 7 minutes total. Step 1. Prepare the oil. Take about a teaspoon of castor oil and warm it between your palms. Rub your hands together for about 15 seconds until the oil is warm. Cold oil on sensitive areas is not pleasant. Trust me on this. If you want to go the extra mile, you can place the bottle in a cup of hot water for a minute before use. Step 2. Lower abdomen massage. You can do this lying down in bed or standing comfortably in the bathroom. Apply the warmed oil to your lower abdomen, covering the area from just below your belly button to right above the base of your penis. Use both hands and make slow, firm circular motions. Imagine you're kneading dough. Not too hard, but with enough pressure that you feel the warmth penetrating deep into the tissues. Move in a clockwise direction. This follows the natural flow of your intestines and lymphatic system. You should feel a gentle warming sensation. Your skin should start to feel more supple. Don't rush this. Breathe slowly and deeply. Let your body relax into the sensation. Step 3. Perineum massage. Now, this is the most important part. Sit or lie down in a comfortable position. You'll need access to the area between your scrotum and anus. Apply a bit more oil to your middle and ring fingers. Place those fingers on your perineum. You'll feel a soft spot there, almost like a small indentation. This is the external access point to your pelvic floor. Use firm but gentle pressure. Make small circular motions, or use a slow back and forth motion, like you're pressing along a line. You might feel a slight ache or tension at first. That's normal. That's the tension releasing. Spend at least 3 minutes here. Some men find a specific spot that feels particularly tight or tender. If you do, spend extra time there. Apply steady pressure, hold for 10 seconds, then release. Repeat. You might notice something interesting. As you massage this area, you may feel a tingling or warmth spreading through your pelvic region. Some men even feel a subtle engorgement as blood flow increases. This is all good. This is your body responding. Step 4. Final abdominal pass. Finish with one more round of gentle circular massage on your lower abdomen. This helps seal everything in, promotes final relaxation, and gives your nervous system the signal that it's time to shift into repair mode. Immediately after, you might notice a few things. A deep sense of relaxation in your pelvis, a warming sensation that lasts 10 to 15 minutes, a subtle heaviness or fullness in the pelvic region, easier, deeper breathing. All of these are signs that circulation is improving, and your parasympathetic nervous system, the rest and digest system, is activating. This is exactly what you want before sleep. Let me set realistic expectations. This isn't Viagra. You won't see instant results after one session. But here's what most men experience. Week 1, better sleep quality, feeling of relaxation in the pelvic area, possibly some tingling or increased sensation. Week 2, improved morning erections, more consistent firmness, reduced nighttime urination because prostate congestion is easing. Week 3 to 4, noticeably stronger erections, faster response time, increased confidence and libido, better stamina. After 1 month, sustained improvements in erectile quality, enhanced nerve sensitivity, greater control and awareness of pelvic muscles, overall improvement in sexual confidence. But here's the key: consistency. You have to do this regularly. I recommend starting with 3 nights per week, say Monday, Wednesday, and Friday. Make it a routine. Tie it to something you already do, like brushing your teeth or your bedtime reading. After a month, you can adjust based on how your body responds. Some men find twice a week is enough to maintain benefits. Others prefer every other night. Listen to your body. Here's the bonus. The benefits don't stop at erectile function. Many men who do this routine regularly report better prostate health, reduced urgency to urinate, better flow, fewer nighttime bathroom trips. The massage helps reduce congestion and inflammation in the prostate, reduced lower back pain, because the pelvic floor connects to your spine. Releasing tension here often relieves chronic lower back tightness. Improved core strength. When your pelvic floor functions properly, your entire core works better. You'll notice this in workouts, posture, and even breathing. Better sleep. The deep relaxation this massage provides helps you fall asleep faster and sleep more soundly. Psychological boost. When you know your body is working as it should, you carry yourself differently. You feel more confident, more vital, more present in intimate moments. This isn't just about sex. This is about overall pelvic health, circulation, and vitality. It's about taking control of your body and giving it the maintenance it deserves. Now, let's go deeper, because there's so much more happening beneath the surface, and understanding this will help you maximize your results. Your blood vessels are lined with a single layer of cells called the endothelium. This layer is only one cell thick, but it's incredibly important. It controls whether your blood vessels relax or constrict. It regulates inflammation. It prevents blood clots. It's basically the command center for circulation. As you age, this endothelial lining gets damaged. High blood sugar, oxidative stress, chronic inflammation, smoking, poor diet. All of these things chip away at the endothelium. When it's damaged, your blood vessels can't produce enough nitric oxide, which is the molecule that signals them to relax and open up. Without enough nitric oxide, your blood vessels stay constricted, blood flow decreases. And when that happens in the vessels feeding your penis, erections become weaker, slower, or inconsistent. Now here's where the oil massage comes in. By improving local circulation and reducing inflammation, you're giving your endothelium a chance to heal. You're reducing the oxidative stress that damages it. And over time, this can actually restore some of that lost nitric oxide production. Think of it like watering a plant that's been neglected. It takes time, but with consistent care, the plant comes back to life. Your blood vessels are the same way. Let's talk about nitric oxide in more detail, because this is absolutely critical. Nitric oxide, NO, is a gas that your blood vessels produce. When NO is released, it signals the smooth muscle in your blood vessel walls to relax. This allows the vessels to expand, and blood flows in. In your penis, nitric oxide is what triggers an erection. When you're aroused, your nerves release NO. This causes the smooth muscle in your pineal chambers to relax. Blood rushes in, and you get hard. Simple. But if your body isn't producing enough NO, or if the receptors for NO aren't working properly, the signal doesn't get through. Your blood vessels don't relax, and erections don't happen. So how do you boost nitric oxide? There are a few ways. Diet. Foods rich in nitrates, like beets, leafy greens, pomegranate, watermelon, get converted into nitric oxide in your body. Eating these regularly supports vascular health. Exercise. Physical activity, especially aerobic exercise, stimulates NO production. Even just 30 minutes of walking a day can make a difference. Sunlight. Yes, sunlight. UV exposure on your skin triggers nitric oxide release. Getting 15 to 20 minutes of sun daily helps. Massage. And yes, the kind of massage we're talking about. The mechanical stimulation of blood vessels during massage causes them to release nitric oxide. This is one of the reasons the oil massage works so well. Now, testosterone. Everyone talks about testosterone when it comes to erectile function, but here's the truth. Testosterone is important, but it's not the whole story. Yes, testosterone supports libido, energy, and muscle mass. And yes, low testosterone can contribute to erectile problems. But even men with normal testosterone can have erectile dysfunction if their blood flow is poor or their pelvic muscles are tense. That said, this nightly oil routine can actually support healthy testosterone levels. How? Because testosterone is produced primarily during deep sleep. And by improving circulation, reducing inflammation, and helping you sleep better, you're creating the optimal conditions for testosterone production. Also, the act of massaging the pelvic area can stimulate the testes and prostate, which are involved in hormone production and regulation. It's all connected. Let's talk more about the pelvic floor, because this is where a lot of the magic happens. Your pelvic floor is a hammock of muscles that stretches from your pubic bone in the front to your tailbone in the back. It supports your bladder, bowel, and reproductive organs. and it plays a direct role in erections. There's a specific muscle called the bulbospongiosus muscle. This muscle wraps around the base of your penis and helps push blood into the penile chambers during an erection. When this muscle is weak or tense, your erections suffer. Another muscle, the ischiocavernosus, helps maintain rigidity by compressing the veins that drain blood from the penis. If this muscle isn't working properly, you might get hard initially, but lose the erection quickly. When you massage the perineum, you're directly accessing these muscles. You're releasing tension, improving blood flow, and retraining them to function properly. Over time, this can dramatically improve erectile quality. Here's something most men don't realize. A congested or inflamed prostate can directly affect erections. The prostate sits right at the base of the bladder, and it surrounds part of the urethra. When it's swollen or inflamed, it can compress nerves and blood vessels, disrupting the signals and blood flow needed for erections. Benign prostatic hyperplasia, BPH, which is basically an enlarged prostate, affects about 50% of men in their 50s and up to 90% of men in their 80s. Symptoms include frequent urination, weak stream, and difficulty emptying the bladder. But it also affects sexual function. The perineum massage, especially with castor oil, can help reduce prostate congestion. The oil's anti-inflammatory properties reduce swelling, and the massage helps drain excess fluid from the gland. Many men find that after a few weeks of this routine, their urinary symptoms improve, and their erections get stronger. Your lymphatic system doesn't get enough credit. Unlike your blood, which has your heart to pump it around, your lymph doesn't have a pump. It relies on muscle contractions and body movement to circulate. The lymphatic system clears out waste products, dead cells, and excess fluid from your tissues. When it's sluggish, which happens with age, inactivity, and inflammation, toxins and fluid build up in your tissues. This creates swelling, stiffness, and impaired function. Castor oil is one of the few topical treatments that can stimulate lymphatic flow. When you massage it into your pelvic area, you're helping drain congestion from the tissues around your penis, prostate, and pelvic floor. This reduces inflammation, improves circulation, and allows your tissues to function optimally. Erections are controlled by the parasympathetic nervous system, the rest and digest system. This is the opposite of your fight or flight stress response. When you're stressed, anxious, or in sympathetic overdrive, erections are difficult or impossible. The problem is, most men over 50 are chronically stressed. Work, finances, health concerns, family responsibilities, it all adds up. And chronic stress keeps you stuck in sympathetic mode, which shuts down non-essential functions like sexual arousal. The nightly oil massage is a powerful tool for shifting into parasympathetic mode. The act of slowing down, focusing on your body, and performing a gentle, repetitive motion signals to your nervous system that it's safe to relax. This activates the parasympathetic response, which improves digestion, lowers blood pressure, and yes, supports erectile function. Over time, doing this routine regularly can actually retrain your nervous system to shift into relaxation mode more easily. You'll find it easier to wind down at night, easier to fall asleep, and easier to become aroused. While the oil massage is powerful on its own, combining it with other healthy habits will amplify your results. L-arginine and L-citrulline. These amino acids are precursors to nitric oxide. You can get them from foods like watermelon, nuts, and legumes, or from supplements. They help boost NO production and improve blood flow. Omega-3. Fatty acids, found in fish, flax seeds, and walnuts. Omega-3s reduce inflammation and improve vascular health. They keep your blood vessels flexible and responsive. Magnesium. This mineral relaxes muscles, including the smooth muscle in your blood vessels. It also supports testosterone production. You can get it from dark leafy greens, nuts, seeds, and whole grains. Vitamin D. Low vitamin D is linked to erectile dysfunction. Get 15 to 20 minutes of sunlight daily, or consider a supplement if you live in a place with limited sun. Hydration. Dehydration thickens your blood and reduces circulation. Drink plenty of water throughout the day. Reduce alcohol. Alcohol is a depressant. It impairs nerve function and reduces testosterone. If you drink, keep it moderate. 1 or 2 drinks max. Quit smoking. Smoking damages your blood vessels and reduces nitric oxide production. If you smoke, Quitting is the single best thing you can do for your erectile function. Exercise, especially aerobic exercise and resistance training, both improve circulation, boost testosterone, and strengthen pelvic floor muscles. Even 30 minutes of brisk walking daily makes a difference. Sleep. Aim for 7 to 8 hours per night. Sleep is when your body repairs, produces hormones, and consolidates memories. Poor sleep destroys testosterone and weakens erections. Finally, let's talk about the psychological side. Erectile function isn't just physical, it's deeply psychological. Anxiety, depression, stress, and even past sexual trauma can all affect your ability to get and maintain an erection. The beauty of this oil massage routine is that it's not just a physical intervention, it's also a mental and emotional one. By taking 5 to 7 minutes every night to care for your body, you're sending yourself a powerful message. I matter. My health matters. My sexual vitality matters. This act of self-care builds confidence. It reduces performance anxiety, and it helps you reconnect with your body in a positive, non-judgmental way. Many men report that after a few weeks of this routine, they feel more present and relaxed during intimate moments. They're less in their heads, less worried about performance, and more able to simply enjoy the experience. And ironically, that's when performance improves. All right, let's bring this all together. I'm going to give you a simple, actionable plan you can start tonight. Week 1. Building the habit. Do the oil massage 3 nights this week. Use castor oil or coconut oil if you prefer. Follow the technique exactly as I described. Keep a small journal and note how you feel each morning. Week 2. Observing changes. Continue 3 nights per week. Pay attention to morning erections. Are they stronger? More frequent? Notice any changes in urination, sleep quality, or pelvic tension. Week 3. Deepening the practice. Increase to 4 nights per week if you're comfortable. Try adding a few minutes of deep breathing before the massage. Consider adding a daily walk or light exercise to support circulation. Week 4. Evaluating results. Continue your routine. Assess overall improvements in erectile function, energy, and confidence. Decide if you want to continue, adjust frequency, or modify the technique. Keep your oil visible. Put the bottle on your nightstand or bathroom counter where you'll see it every night. Out of sight is out of mind. Tie it to an existing habit. Do it right after brushing your teeth or right before you get into bed. Habit stacking makes it automatic. Set a phone reminder. For the first 2 weeks, set a 9:30 p.m. reminder on your phone. After that, it'll become second nature. Warm the oil. Either rub it between your hands or place the bottle in warm water for a minute. Warm oil feels better and works better. Create a relaxing environment. Dim the lights. Play soft music. Make this a ritual you actually enjoy. The relaxation itself is therapeutic. Don't skip the perineum. I know it feels weird at first, but this is where the biggest benefits come from. Give it a real chance. Be patient. Results take time. Most men see noticeable improvements by week 2 or 3, but some take a full month. Trust the process. Consider involving your partner. Some men find that doing this massage together with their partner, or having their partner help, turns it into an intimate bonding experience. It's entirely up to you, but it's worth considering. Don't stress. This isn't about perfection. If you miss a night, just pick it up the next day. Consistency matters more than perfection. Even if you only manage twice a week, that's still beneficial. After the first month, evaluate how your body is responding. If you're seeing great results with 3 nights per week, stick with that. If you want to boost results, try 4 or 5 nights. If you're experiencing any irritation or discomfort, scale back to twice a week and use less oil. Listen to your body. It will tell you what it needs. Always wash your hands before and after. Keep your oil bottle clean and sealed. Don't share your oil with anyone. If you notice any lumps, unusual pain, or changes in your genital area, stop and see a doctor. This routine is not a substitute for medical care. Men on blood thinners should avoid this because massage can increase bruising. Men with active infections or open wounds in the area should also avoid this. Anyone with a bleeding disorder should not do this. If you're unsure, check with your doctor first. So here we are. You now know more about your vascular health, your pelvic floor, and your erectile function than 95% of men your age. You understand the science. You have the technique. And most importantly, you have a simple, practical tool you can use starting tonight. This isn't about magic. This isn't about turning back the clock or chasing your 20-year-old self. This is about optimizing what you have right now. It's about supporting your body's natural ability to function, heal, and perform. Your body deserves this kind of care. After decades of working for you, carrying you through life, healing injuries, fighting off illness, it deserves 5 minutes of focused attention before bed. That's not too much to ask. And here's what I want you to remember. After 50, it's not just about adding years to your life. It's about adding life to your years. It's about waking up feeling vital, confident, and capable. It's about being present and engaged in intimate moments. It's about feeling like yourself. This oil massage routine is one small piece of that puzzle, but it's a powerful piece. Combined with good nutrition, regular movement, quality sleep, and stress management, it can make a profound difference in how you feel and function. So here's what I want you to do. Tonight, before bed, try it. Just once. Follow the steps I gave you. Spend 5 minutes caring for your body. And tomorrow morning, notice how you feel. If it works for you, and I believe it will, make it a habit. Commit to 30 days. Share it with a friend who could benefit. Because here's the truth. Men don't talk about these things enough. We suffer in silence, but there's no reason to. Your best years are not behind you. With the right habits, the right mindset, and a little effort, you can stay strong, vital, and confident well into your 60s, 70s, and beyond. This routine is just one tool, but it's a tool that too many men overlook. Don't be one of them. Your body is capable of so much more than you realize. Give it what it needs. Be consistent, be patient, and watch what happens. You've got this.